Today is Medical Monday, and as the new school year begins, so do a number of sports seasons, which means, unfortunately, there are bound to be an injury or two for some teams out there. We're joined live this morning by Dr. Lafi Khalil, an orthopedic surgeon, to talk about the treatments available for those who do get hurt while playing sports. Good morning.
Good morning. Thanks for having me.
Yes, thanks for joining us, Doctor. First off, tell us a little bit about who you're with and what you do exactly.
Sure. I am with the Ortho Michigan group here in the Flint and Genesee County area. We have offices in Fenton and in Flint. And obviously, we are affiliated with the Hurley Medical Center as well, where we patients. So I'm a sports medicine specialist. That means that I take care of injuries to multiple joints, knee, hip, shoulder, elbow, ankle, but mostly musculotendinous injuries. So, muscle tears, ligament tears. So, obviously things like ACL tears, rotator cuff tears in the hip impingement, hip labrum tears, things of that nature.
Yeah, so you see a great variety of different injuries, it sounds like. So, what do you do then to help kids heal after an injury?
Well, we're really lucky at Ortho Michigan to have 5 different physical therapy locations. So, most of the musculoskeletal pathology that we see in clinic, probably more than 80 to 90%, is initially treated non-operatively with physical therapy. And we have great therapists here, and we work together collaboratively. We message back and forth about patients all the time and make sure that we're getting them on the right progression. We also have a variety of bracing options available for injuries that need them. And along with myself, I have a partner, Dr. Matthew Zaborowicz, who's a sports medicine specialist in the primary care field. And so he does a lot of non-surgical, but still procedural and interventional type of procedures, such as ultrasound guided injections. And he also brings the, clinical and medical knowledge to sports medicine. So together we collaborate and send patients back and forth as needed to make sure that they get the best care that they need.
Sure, and speaking of that, talk about the importance of getting that appropriate care. And, with kids, are they able to bounce back when it comes to getting back on the field or whatever sport they play? It seems like kids typically bounce back better, but talk about the importance of getting treated, period.
Yeah, that's a good point. They definitely bounce back faster than you or I. Sports medicine isn't just for young kids or elite athletes. Sports medicine is really for just regular people like myself, like you listeners at home, weekend warriors, recreational activities. But, with regards to high school sports starting up and kids sports and football in particular, there are some pains that it's okay to play through. There are some pains that it's okay to manage, the amount of snaps you take or the time that you're out on the field. But it's never a bad idea if you're very concerned, and parental discretion advised. If you're very concerned, bring them down. We can obviously evaluate them. And at Ortho Michigan, between myself and Dr. Zaborowicz and a number of other providers, if you have an injury that happened on a Friday night, at a high school football game or over the weekend, just recreationally, give us a call. Our office knows that if you tell them that you have a sports-related injury and that you need to be seen acutely, we will make sure we see you either the same day or the next day so that you can get back on the field for later that week.
Yeah, bottom line, don't ignore, get that treatment that you need. And I love how you lumped us in together there, my friend, on bouncing back. That gave me quite the chuckle. Thanks for your time, for joining us today, Dr. Lafi Khalil.